that no secondhand smoke, there's no safe level of secondhand smoke from the Surgeon General, is something that's critical information. We know the downside effects. Where I'm challenged, you know, as a TriMet board member, is in regards to the staggering figure that low-income people are 3 times as likely to smoke than higher-income individuals. You know, that's the part that's a little, I shouldn't say a little, it's a lot alarming on many levels. And as we look to implement, you know, further smoke-free campuses, it really caused a question for me at least. You know, how do we address? You know, when I think from poverty, prosperity, and many of you have heard me say that many times, I'm a little challenged in regard to think about these individuals that are trying to move from poverty to prosperity, get a job, and move up, and they're struggling with you know, with this addiction, which we all know is very, very powerful. And you know, the programs. You know, one of the questions that I think I would have for Dr. Cohn would be, how has the percentage of the population who smoke changed over time? So let's go, you know, back half a century to today. I think it was just stated that about 15% of adults in the state of Oregon actually are addicted to smoking. Has that changed over the time?
Yes, Mr. Stoll, there was a time in this country when more than 50% of adults smoked. In fact, there are some great pictures, if you want to, if you have a good sense of irony, of doctors actually hawking, excuse me, hawking cigarettes, being featured in advertisements, talking about how you know, this brand is less irritating to your throat than some other brand. Those days are long gone. We peaked in, I believe it was 1963, and the numbers have been dropping since. But we know that with the implementation of smoke-free policies like the one that you are considering, that has really turned the tide in a very dramatic way in terms of driving down rates. I mean, numbers started to drop as the marketing controls around tobacco started to tighten up. But when we started to have these other kinds of things like smoke-free policies, really supporting people to quit, because if you're trying to quit and you're around, you know, you smell cigarette smoke, something like that, it makes it that much more tempting to relapse and go back. I think, you know, the issue around low-income folks, it's been something we've been focusing a lot on in our tobacco programs across the state, thinking about, for example, in our communications, how do we make sure that we're reaching those groups in particular. And so I think it's it is a very disturbing figure. It has a lot to do with the marketing and the way that tobacco is marketed specifically to those folks. But I think there's a lot that we need to do to pay attention to that. We've been working on that over the years. A lot of the drop in tobacco use has been disproportionately among wealthier folks. So we need to drive those same reductions in lower income people as well.
So with the implementation of this, you know, I used to work in healthcare, and of course it was much easier to do campus, you know, smoke-free campuses, because the percentage of healthcare folks that are in the workplace, there's a much lower percentage of healthcare folks that actually smoke. In the implementation in other organizations, and I think somebody said that at state level there are a number of state offices that have gone to smoke-free. The implementation, I guess, is something that's really going to be core in my mind. How do we do that to ensure that we can help with this transition, but also, you know, the punitive nature of what I'm assuming is going to occur is if you're caught, you know, smoking on campus, you know, there could be some punitive deals that go into place, which then I think kind of short circuits the idea of moving from poverty to prosperity. So that would be more so something that, you know, I don't think we have in detail here, but and I'm sure part of that's going to depend on what our contract is with the ATU. But that's something that's really going to be something that, as a board member, I'd want to be a part of, especially with the information, you know, that we continue to see this significant burden on the lower income folks, and that for me is very challenging. Again, I am completely supportive of smoke-free, You know, I personally, I've never smoked, except for once. I did do it once, then I did inhale. But I've never smoked a pack of cigarettes since then. And so, but, you know, if in the big scheme of things, the cost of that, and for all intents and purposes, I'm addicted to sugar, so everybody knows that now. If you see me holding a donut, tell me to throw it away. But obesity is also a significant issue, health issue for the state, for the country. So we've got some other things that we need to be tackling. But I don't want to go sugar-free campuses just yet.
I would just respond that you will have the full support of the folks who best know how to do this in the state behind you as you move forward. The public health system, Lung Association, TOFCO, all of our partners will be there to help assist you do this in the best way possible.
Yes, I would second that, and I do share your concern and understand the concern about health disparities. And I think implementing a policy like this is one of the ways where we can help eliminate that disparity and improve health outcomes for those individuals, for employees of TriMet. So I see this as a step forward in reducing that disparity. To follow up to your question.
Do we know what percentage of our workforce smoke?
Lucy, I saw Lucy here.
Well, we just estimate based on statistics about 20% or possibly 500, but we have no way, we have not surveyed.
Yeah, bottom line, I think this is the right thing to do, but I must admit to some trepidation. And the experts here, maybe you can help me with this. I am a lifelong non-smoker. I really do not like to be around smoke at all. And I started working in a time when smoke was everywhere, particularly in the workplace, and I really resented the fact that when I went to work, I couldn't breathe clean air, and I really felt like my rights were being denied. You know, it's like we're going the other way, and so people who smoke, it is an addiction. You say that the majority of them want to quit, but for those who are unable to quit, it's like we're putting additional burden on them, and so having come from that one side where I was so resentful that I couldn't exercise my rights to clean air, people do have the right to make their own choice. Now, yeah, get them away from the buildings, get them, where they're not going to impact other people. No problem whatsoever. But how do we reconcile that?
Okay.
Sorry.
I think it's a challenging question. Tobacco is a legal substance, and but I think you touched on exactly the issue that when you're in a place where there are other people around, your choice isn't just your choice anymore. Excuse me, you're making choices for other people. I'm not a smoker, by the way. That's not a smoker. I think when you put on top of that, not just the exposure to the smoke, but the financial impact. I listened to your budget report. I run an agency myself. I'm familiar with a lot of those stresses and strains. As we think about reforming healthcare so that we're going to save money there, one real way to do that is reduce the need for healthcare in the first place. And that's what these kinds of policies are very powerful tools to do. So, at least in my mind, the way I deal with this question is to make sure that as we implement this, we do it in a very humane way. We're not about demonizing smokers. We try to do everything we can to give people the help to quit. And we do know that with medication and counseling, you can double or even triple the success rate of quitting. So those are powerful tools, and we should absolutely use them.
And I also wanted to respond. I definitely hear your concerns and what you're saying. And in addition to what Dr. Cohn just said, just a couple of things. This focuses on the habit, not the person. And as a lung association, as a, cessation provider, we're always careful to, focus on the habit, not the person. It's a, this is a compassionate decision, and we want to move forward in a humane way, as you said. I think it's also important for changing, just continuing to change the social norms in our society. 30 years ago, we used to be able to smoke on airplanes. Now, that would seem, ridiculous to anyone. And so this is just another step forward in that process from the Lung Association's point of view. And then the last thing I would add is that TriMet would be following several government agencies. The state of Oregon, as Dr. Cohn mentioned, Multnomah County just made their campuses tobacco-free. And I believe Metro Regional Government also did the same. So this would be following those examples in local government.
Thank you. I do appreciate that. It's, as I say, there's no question, that I will be voting in favor of this, but, hearing, that kind of discussion, and also, hearing what you were saying about the efforts that we will go to support people who choose to stop smoking. I think has to be a really important piece of this. And with those, I'm very comfortable voting for this.
And I guess I would just say I'm one who lost a father to lung cancer because he was a smoker all his life. So I definitely don't like smoking and applaud this policy. And to kind of, I think maybe just to make some board members feel better, by approving this today, we're not authorizing signs to go up tomorrow to essentially restrict everybody. What I read here is we're authorizing and directing the general manager to develop and implement a smoke-free work environment policy to promote a safe and healthy workplace by prohibiting smoking at all TriMet buildings and properties. So there's some work yet to be done, and I assume that the transitions would do that. Maybe when we act on this, which I hope we act on this, maybe we can get some updates as some of the major implementation things are upon us that you think we're going to be doing. So we understand what's happening and how that would be implemented in a way, and what you've done to address some of the implementation concerns and other things that are brought here today. So with that, I'm ready to vote on this if the board is. So I would entertain a motion to approve Resolution 1301-04. Did I hear a motion?
So moved.
Did I hear a motion? I hear a motion and a second. Is there any further discussion of the resolution? All in favor of the resolution signify by saying aye.
Aye.
All opposed? Hearing none, the motion is approved unanimously. Thank you very much. Moving on, we have 3 agendas related to light rail facility and properties that we have. I'm sorry.
And before that,
Oh, I'm sorry, I skipped one. Thank you very much. Let's go back. I'm trying to get us out of here quickly. Let's go to Resolution 13-01-05, which is ratifying and authorizing a contract with Oregon Dental Service for administrative services.
we'll try to make this fast. Just to note that we have moved, starting in calendar year 2012, to self-insurance of our dental benefits. And there is a savings associated with that, estimated about $75,000. But in order to provide good service to our employees, and those are both union and non-union employees, we employ a contractor to help provide those benefits and administer those benefits. And the most qualified and experienced in providing a continuity of service to our employees is the ODS, or Oregon Dental Services. So with that, we have negotiated the rates for this administration, and the total contract that's recommended to you is actually a 3-year contract for ODS, and it would total the contract over 3 years should the option years after the first, for the second and third year be exercised. The total cost is estimated at $638,496. And with that, can't be answering any questions, but do recommend it.
Is the question here?
But this is retroactive 1 year, so in point of fact, we'll just have 2 years left on this contract after we approve it.
That's right.
Other questions?
And this is for all employees, both?
Yes.
both union and non-union.
Union. Well, yeah, so I figured I didn't need to say anything else.
As well as retirees,
Okay.
who are also covered by the dental insurance provisions.
No other questions? Are we ready for a motion?
I move approval of resolution 1301-5.
Thank you. Very
So
much.
move, so, second.
I have a second. Any further discussion? All those in favor of the motion to approve resolution 13-01-05, please signify by saying aye.
Aye.
All those opposed? Hearing none, the motion is approved unanimously. Now we'll turn the page and get to the three items that relate to the rail construction and related facilities. I say that because I have one gentleman who has indicated he'd like to speak to all three of these, so maybe we can do the first one, invite that person up and see if the testimonies in general about all of these. So, Mr. General Manager.
Mr. Board, members of the board, Resolution 06 is essentially an augmentation of our staff as we begin the remodeling of the River Junction library facility, maintenance facility on Gresham. It is a contract with PB Americas, Inc. For that augmentation. PB did do the design work, so the firms are familiar with the plans and expectations of our contractor there. And this is really, again, an augmentation of our staff associated with performing this and overseeing this work. We have great confidence in the individuals that have been proposed to us to fulfill this contract. The proposed modification is for $700,000. And again, we believe that this is useful not only for the expertise that the staff brought on board, but because our current staff is fully occupied with the rest of the project. So there's a peak loading, peak scheduling problem here. And so, in addition to that, there's special expertise they bring, which is very helpful related to the, frankly, remodeling one of the more critical facilities. I've often related this to open heart surgery on a awake patient. We need to keep everything moving and flowing as this remodeling work continues both in the yard and with the facilities. And so with that, I would just also note that PB is achieving their disadvantaged business enterprise goal of 16% and is achieving that currently, and they're expected to maintain that percentage through the completion of the contract. And with that, I'd be willing to entertain any questions or recommend approval.
Questions? Yes, Craig.
This is to have PD provide a resident engineer.
Right.
What is the role of a resident engineer?
They are resident on the site at the project and actually become our representative in terms of directing, overseeing the work and approving work. So generally our on-site representative. And within that, they work within our chain of command or chain of control, if you will. So they work directly for us.
Okay, does having that service provided by the contractor cause a problem in terms of oversight?
We've actually done this in a number of cases, and I think the answer is no, because we provide oversight to the engineer. But the other thing is that the individuals that we select for this are really hand-selected to be individuals of high experience and high quality that we have great confidence in. So I think that's the case at this point. Dan, did you have anything else you wanted to add to that?
Good morning, board members. Perhaps I want to make it clear that PB Americas is the designer of the work, not the contractor of the work. So we are getting the designer here. I would also add that this position is one of 3 positions that we'll have on site. They do both the commercial management of the contract as well as enforce all the technical specifications. This position is through a consultant, and as Neil said, partly that's because of availability, but also we sort of try to use consultants for our peak loads, and we're at our peak loads now for hiring, and that way we kind of keep our TriMet workforce more level. So this position is consultant. The other 2 are an office engineer who's pretty much full-time in commercial management, and inspector on site full-time. Both those positions are TriMet employees, so they bring all of sort of the know-how of the TriMet processes and paperwork and so forth.
And I just want to reiterate, because you corrected me, which I appreciate, that PB is the designer, not the contractor. And that's a really important distinction. So, thank you.
And what we're actually considering today is the modification from the 3.2 million to 3.9 million, this $700,000 difference. And so the 3.2 million was what was approved in 2011.
That's right.
Which then was all the design services.
That's correct.
The original design services and engineering services. And so the 700,000 is this new role that they're going to be playing as the resident engineer.
That's correct. This is added work. It was an option under the contract, and we're choosing to exercise that option rather than have a TriMet hire.
I think that's the other important thing, though. What I read here is instead of staffing up TriMet, you're going to use the money that is budgeted for staff to fund this work.
That's correct.
Okay. All right, other questions? Okay, feel some comfort in moving. Wait a minute. Let me go to Mr. Al Margulies. What is it again?
Margulies.
Margulies, come on up, please.
I actually have objections to 3 of these items, and they're all based on the same thing, which is board authorization is required because the proposed modification increases the contract amount beyond what was originally authorized by the board. So this, and you're the only director that actually questions this a little bit. I think the public has a right to know when you're asking for these modifications, just giving away money. I'd like to know exactly. You know, you got some very vague answers, but I think the public has a right to know exactly why these are so routine. I mean, every contract that comes in front of this board is routinely approved, except for one contract, which is, of course, the union contract. So this is awful vague and awful general, and you know, you're dealing with millions of dollars here. Don't you think it would be advisable to actually allow a little bit more detail as to why you're increasing these contracts more? I mean, you got how many millions here? Because the only thing I ever hear you saying no to is the union contract, but all of these other contracts, yes, yes, yes. And there's only one director that even mentions it. That's what I have to say about the 3. You don't have to put me up here for each one, but that's my point that I wanted to make. I wish we would get more definition to these increases than these vague, well, the money is there and we're required, or we could use it, so we'll use it. Thank you.
Thank you. Appreciate it. I guess I just say that I think all of the board here has read the information, has questions. We're pleased that Travis usually brings up those issues, so we don't all have to do that. But I think they are pretty doggone specific in terms of what the monies are being used for and why the expenditures are being made. If they weren't clear, we wouldn't be approving them. So I feel that we got the answers we need here. I guess we'll find out here in a moment if the whole board feels the same way. So are we ready for motion on this resolution 13-01-06?
Yes, someone.
I hear a motion? Second. I hear a motion and a second. Is there any further discussion, questions? Okay, all those in favor of the resolution 1301-06 signify by saying aye. Aye. All those opposed? None. Thank you very much. Motion is approved unanimously. Let's go on to resolution 13-01-07, which is authorizing a modification to the contract with Hoffman Construction Company of Oregon for the renovation of Center Street building. Mr. General Manager.
Mr. Board President, members of the board, recall that at various points in time we bring to you different layers of our construction management / general contractor contract. So again, this is one related to the contract that was awarded originally to Hoffman Construction Company in a very competitive process for the remodeling of the Center Street Administration Building. We have been progressing with that contract, doing very well in terms of the initial scope of work. The initial contract was $3.4 million. Included all the pre-construction work, including estimating, working with the designer to make sure that cost-effective design was in effect, and also some of the early construction work around, for example, changing parking lots and other activities. This modification is another layer in this contract, which will be followed by successive layers as we continue to develop the design and work through the cost estimates with the designer and the contractor. This modification increases the contract amount by $886,000. It's primarily for demolitions services. It's less than our independent cost estimate. And is within our budget for the Center Street administration work. And we recall that most of this budget comes directly from the Portland-Milwaukee Light Rail project. We're also requesting board authorization for a change order allowance associated with this additional work of $88,603. This is a little bit like remodeling the bathroom in a 1950s house, so you never quite know what you run into, which is why the change order allowance is recommended in this case. I would note that Hoffman is currently achieving the disadvantaged percentage that they have committed to, 25% participation for this work. And we're looking forward to continuing to work with them. The work has been absolutely excellent. Looking ahead, again, other layers of this contract will be coming to the board in the upcoming months, and that will include the construction on floors 2, 3, and 4, as well as the installation of the control center that will be done and the call center that will be done floor 4, and then we'll come back finally with a remodel of the first floor of the Center Street Administration Building. So these will be finalized as the design is complete, the estimates are complete, and the negotiations are complete, all subject to independent cost estimates, and we'll make all of that transparent to you in the future. So with that, I'd be happy to answer questions or defer them to Dan or his staff and recommend approval.
So Director Stovall, do you have any questions?
So in this regard, this isn't the same kind of contract we are under where it's or is it where we have this design, construction manager, GC, or we're incrementally approving the budget as we go along based on their ability to kind of see what's coming up next?
Yes, it is CMGC style of contracting,
Okay.
where TriMet holds separately a design contract, and we use the contractor's advice to help us design as efficiently as possible. And we generally award the work in phases. So this is the second phase for the demolition of the second through fourth floors.
So then the 886,000, that's basically the next phase. And so as someone would read modification, it's not the traditional sense of what the modification is. It's our ability to control cost and do a better job of construction management, where we have an overall kind of approval of a budget, and then we have the opportunity to put the next phase in and approve that, correct?
That's correct.
Now the 88,000 though, is that something in additional? That's the change order allowance in regards to the $886,000 modification?
It is something different. You are giving us your authority to set aside those funds outside of the contract and bring them into the contract should we need them.
And a standard, what we would consider this change order allocation, 10%, and that's where we're at here, right?
They can vary widely. So underground work, we might be looking for anywhere from 10 to 20% based on how deep it is and how much we know about the ground conditions. Generally, our track work contracts are down in the order of 3% change order allowance, and we even underrun that very often. And so it just has a lot to do with how much we can know about the contract. So for demolition in a building built in 1978 that's had some deferred maintenance, 10% seems very reasonable allowance. But until we start tearing out windows and partitions and carpets, we're not exactly sure what we'll find under there.
And as far as total budget, we're tracking with what our overall original budgeted, or not necessarily budgeted, but projected amount is and was.
Yes, we are.
All right.
Thank you. Other questions, comments from the board?
Yeah, I do have a question. So the 88, if needed, just seems like an odd number, if needed. So we know we're going to need it because of the amount.
No.
So it's not 90,000, it's 88.
We just used a straight 10% of the amount for this phase. But we don't know for sure that we're gonna need it. We anticipate it. I would say we wouldn't be surprised to run into change orders where we need to do some additional work of that level. But it's not automatically given to the contractor. It's held by TriMet and used if needed. It just means we don't have to come back and ask for your permission for an additional contract increase for that level. If we want to go higher, of course, we will have to come back.
So again, following up for Commissioner Snowball's question, this is again to deal with unexpected discoveries as you move into the demolition.
The 88,000.
Right. Which again, as you pointed out, renovated an old building understands that you'll often find stuff you weren't expecting. So this is just some good standard practice in the industry.
One more question, and this is less so, for challenging what we have here, more so just to gain clarity. In regards to this type of situation where, this number's going to be well known, publicly known, are there any incentives that many times you feel like if you throw out there a contingency number, it's like it's already spent. Do they have any motivation to not utilize that contingency money, or is it just pretty standard to say, we do have some contingency money there for it just in case you use it?
It's certainly possible that the contractor will know this number, and whether that would factor into their thinking, I don't know. It is by board rules, we have to have your authority for that, correct. So it becomes a public number. But really, just because of the presence of the number doesn't mean that the contractor can draw it down. They have to convince us for any additional work that that there's merit to the argument and that it's outside of what we negotiated for the base work. And so, knowing it's there doesn't necessarily make it available.
Good question. Good question. Here we are as a public agency. Everything we do is transparent and open. So those are one of the things that you have to recognize when you're in contract and buying property and so on. So good question. So others from the board? Okay. With that, then, do we have a motion to approve resolution 1301-07, which is authorizing the modification of the contract with Hoffman Construction Company for the renovation of the Center Street building?
So moved.
I hear a motion.
Second.
Okay, got a motion and a second. Any further dialogue, discussion? Okay. All those in favor of the motion to approve resolution 1301-07 signify by saying aye.
Aye.
Any opposed? The motion is approved unanimously. Moving on to our last resolution of the day, resolution 13-01-08, authorizing a modification to a contract with Cressa Portland LLC for real property planning and management services.
Board President, this is also a modification to an existing contract. We approved in March of 2011 a contract with Cressa Portland LLC to assist us with the remodel and move associated with the remodel of the Center Street Administration Building, what we sort of drafted together called the Moving Together program. And their services have proved incredibly valuable to us as we've gone through the work so far. I think it is an area that probably would have said that actually in terms of our own staff, we are probably quite unprepared for the amount of work associated with this move, moving all these employees around from different places to new places. And Cressa has been very valuable in terms of providing an augmentation of our staff associated with many of these additional services. We are, right now, because we've used more of the services than we originally anticipated, we are not over the contract, but in order to complete the scope of work, we would like to come back and ask for some additional authorization. And there are other ways to do the work, but we think that Cressa has done an outstanding job for us and continuing them would be a very good business decision on our part. The modification would increase the contract by $247,650, and that would take it from $335,775 to $583,425. And again, this is within our independent cost estimate for the work and is within our budget for the project associated with the work. Again, this was a contract that was originally procured by RFP competitively. And with that, we can be happy answering questions, but I do recommend approval.
Comments, questions? Director Snowball?
So just to make sure that I've got a good understanding of this, when we say that it was within TriMet's budget for the project, then we ultimately, I mean, the total 583 is what we, the line item that we had for this project, for this part of the project.
A broader line item that is part of the overall moving together synergy model, but I'll let you know.
The budget that covers the difference, this increase, would come from our staffing budget, which is under budget by quite a bit more than this, because we have deferred some hires and used some consulting help, including this contract. So overall, the project is under budget. This increase in this contract budget comes from staffing.
Okay, so as far as this line item goes, this wasn't necessarily budgeted at this amount originally.
Correct.
But as far as the total project, even with this addition, we're still going to be at or below budget.
Exactly. We'll
Okay.
be doing a budget transfer from our staffing budget to the line item for this contract to cover this increase.
And so was the original plan to use staff on this, or we were just able to actually use less staff than what we originally budgeted? And then essentially because I think at one point, Neil, you mentioned that what we're doing with this, with Cressa, is so we've just kind of expanded, the scope of what they're working on.
I would say that the staffing budget is more of a pool. It's based on assumptions that we do back in the preliminary engineering phase, where we try to identify all the positions we're going to need, when they're going to start, when they're going to finish, how much they're paid, what their fringe benefits are. And that generates a pool that's assigned to the staffing budget. Now, we're well under that amount, mostly because the rates have been a little bit lower, and particularly because we have hired later than that budget plan. So to use some of that accrued savings for this additional work is what we're proposing. The reason for the additional work is not because we didn't hire people that were going to do this, it simply was more work than we allowed for.
Mm-hmm. So in the end, it actually is really positive that we're able to become in that, that far below budget and increase the scope of work over one of our consultants and still be able to come in under budget. So,
and as I said, with one of the earlier items, this is partly about the peak load for employee hiring.
Mm-hmm.
We have some vacancies remaining. In the next several months, you'll see some on-call contracting, and we will use some of those on-call contracts as we need, those last few people for shorter terms.
Mm-hmm.
Because at some point, it's just the expense of hiring and trying to get somebody to do a short-term job. It might be easier just to pick an available person from here in town.
No, I think it's hard to see in these resolutions as a series of resolutions. Your questions are right on, and I'm wondering, I know there's a point where we show where we are in relation to these contracts and what's been spent and how much for contingency. I'm not sure when that's the next time we would see that, but that would help give us a bigger, or the big picture versus, having to question each of these, because it does look like we're going over each time. So is there a way to do that? Well, there is a way, but when the timing is appropriate, do that we can look at.
One suggestion would be, and I think it is appropriate to begin to do that on perhaps maybe a quarterly basis with the board, but we do send a monthly report that does include all of those calculations.
Mm-hmm.
But I think it would be really helpful to come perhaps quarterly and actually walk through sort of a high-level view of that, so that we make sure you're all tracking where we are with all of it on a regular basis.
And I appreciate you mentioning that we do give monthly reports regularly for the public's benefit, and those that have concern, they can also say that as well.
Yep.
Well, in the end, what appears like a significant modification is actually an opportunity to say something commendable, because ultimately to come in under budget from independent cost estimates, I think it's on construction projects, it's something that's actually impressive.
That's right.
Board Member Schweitzer knows. Construction projects rarely come in under budget and on time. So it's really nice to see that we're doing that, especially with an independent cost estimate already, so good work.
Thank you.
Thank you.
I guess I applaud the agency for looking at staffing the peak loads with contractors and consultants rather than hiring staff, because it usually is much more expensive to go through the recruitment, hiring, training, and then ultimately the expenses that you bear when you have to lay those people off after the work's done. So I think this is a really good decision on for most of these kinds of projects. So good work. So are we ready then to move action on resolution 13-01-08?
So moved.
Mayor, motion.
Second.
Mayor, second. Any further discussion of the motion? All right, with that, all those in favor of the motion to approve resolution 13-01-08 signify by saying aye.
Aye.
All those opposed? Hearing none, this motion is approved unanimously. So that's the end of our business meeting today. So unless there's other things to come before the board today, I'm going to adjourn the meeting, and we'll go right into our public forum. And I just note it's in our agenda, the public forum begins at the conclusion of the business meeting, is not part of the meeting. People wishing to testify during a public forum are encouraged to submit their full testimony in writing and summarize their comments at the meeting. Public comment should be limited to 3 minutes per speaker. The number of speakers allowed to present depends on the number of people wishing to address the board at the time the meeting is scheduled. At this time, I only have,
Excuse
go
me,
ahead.
I need a quick break. So-
Oh, you need a break. Well, why don't we take 5 minutes, come back, and I would point out just that we have 5 people who'd like to address the board in the public forum. Thank you for speaking up.